This video is a presentation of information and sample administration of the Roylan Stereognosis kit and the Moberg pickup test. The Roylan Stereognosis kit tests active and passive stereognosis. The test can be used on any age person thought to have a hand injury and can be used in any setting. It contains 3 tests, all done on both hands. The tactile active test asks clients to name an object by manipulating it. The tactile passive test asks clients to name an object by having it placed in their palm. The cross-modal test asks the client to identify an object by manipulating it and pointing at a picture. For the sake of time, only the right hand is shown.
Hi, Ms. Mitchell. My name is Christine Mitchell, and I'm going to be your occupational therapist today. Today we're going to do a test called the Roylan Stereognosis kit. Stereognosis is when you can identify an object without using your eyes, with just using your fingers. And so today we're going to be testing your sensation in your right and your left hand. Alright, please put your hand through the hole. I will be placing common objects between your thumb, index, and middle finger. You may manipulate the object with your fingers. Tell me what the object is as quickly as possible. You cannot touch the object with the fingers of the other hand.
Out. Paperclip. Button. Pen, clothespin, pencil, cone, penny, dice.
Now, Ms. Mitchell, we're going to do a different part of the stereognosis test. Please put your right hand through the hole in the shield. Open your right hand, palm up. I will be placing common objects in the palm of your hand. You tell what the object is as quickly as possible. You cannot touch the object with the fingers of that hand or the other hand.
Key. Belt. Nickel. pen, penny, paperclip, key, marble, quarter,
Now you can pull your right hand through the shield. Please put your right hand through the hole in the shield. I will be placing common objects between your thumb and index fingers. You may manipulate the object with your fingers. Identify the object by pointing to the card with the correct picture on it. Answer as quickly as possible. Go ahead and put your right palm up.
boat, boat,
As you can see, these are sample score sheets. The score is based on the time it takes a client to identify an object and whether they are correct or wrong. Based upon our scores, I did not recommend occupational therapy. Ways to improve reliability of this test are that everyone that administers this test should be trained, a standardized procedure should be implemented, and a standardized scoring procedure should be implemented. Ways to improve validity are only include objects that fit into a person's palm without touching fingers to decrease sensational cues. Only include one die and one marble to decrease the likelihood of them clinking together and giving an auditory cue. And test this test against another stereognosis test. The next test is called the Moberg pickup test. It tests impairment of the median nerve using fine motor and stereognosis. It can be used on any age person suspected of having a nerve injury. The test can also be used to screen for hemi-neglect. The test contains 4 tasks: pickup with vision, pickup blindfolded, stereognosis with blindfold, and stereognosis with blindfold and without the ulnar fingers. The modified Moberg pickup test is a version of the Moberg shortened to save time. It contains 2 tasks done on both hands: placement of objects with sight and identification of objects without sight. Here are examples of the Moberg pickup test and then the modified Moberg pickup test.
Hi, Ms. Mitchell. My name is Christine Mitchell, and I'm going to be your occupational therapist today. We're going to do the Moberg pickup test, which is going to test your sensation and your stereognosis to see if you have feeling in your fingers. Alright, so our first task, you're going to pick up the objects from the desk and put them in the container when I say go. Ready, go. That time you used your right hand, this time you're going to use your left hand. Ready? Go. Alright, for this next test, you're going to do the same thing using your right hand, but this time I'm going to blindfold you. Alright, just using your right hand. Ready? Go. This time you're going to use your left hand. Ready? Go. With the blindfold on, I'm going to put an object in between your middle finger, your index finger, and your thumb, and you're going to tell me what you think the object is. Alright, can you give me your hands, your right hand palm up?
Wing nut. Screw. Or nail, I guess. large X nut. Nickel. Dime. Washer. Paperclip. Paperclip. Small X nut. Square nut.
Alright, now Miss Mitchell, we're going to do the same thing but with your left hand.
Small X nut. Nail. Key. Wing nut. Screw. Large X nut. Dime. Safety pin. Small X nut. Nickel. Paperclip. Washer.
Alright, now Miss Mitchell, you're going to give me your right hand, and I'm going to tape down your ring finger and your pinky so that you can't use those. And we're going to do the same thing. I'm going to put an object in your fingers and you tell me what it is.
Screw. Key. Small X nut.
keep your fingers. And now we're going to do the same thing with your left hand. Give your left hand palm up. We're going to take down these fingers. Alright, we're going to do the same thing. I'm going to place an object in your fingers, and you're going to tell me what you think it is.
Safety pin. Screw. Washer. Nickel. Square nut. Small X nut.
Alright, Ms. Mitchell, I'm going to remove your blindfold. And that concludes our testing. Thank you.
Thank you.
Alright, Ms. Mitchell, we're going to do the modified Moberg pickup test. And first we're going to start it off, and you're going to use your right hand and put these objects into that container. And I'm going to time you. Ready? Go. Now, I would like for you to use your left hand and put these objects in that container. Ready? Go. Now, I'm going to put a blindfold on you, and you're going to give me your right hand, and I'm going to put an object in between these three fingers, your thumb, your index, and your middle finger, and you're going to tell me what you think the object is. Now we're going to do the same thing with your left hand. Mitchell, I'm going to remove your blindfold. And that concludes our testing. Thank you.
Thank you.
Here are sample score sheets for the Moberg and modified Moberg pickup test. Scores are based on the amount of time it takes for a client to put all of the objects in the container or to identify an object. After comparing scores, I did not recommend occupational therapy services. Studies have shown that this test has inter-rater reliability, but more ways to improve the reliability are to standardize the procedures, that everyone that administers this test should be trained, and standardized scoring procedures need to be implemented for when a client gets an answer wrong. Ways to improve validity are compare this test to another Stereognosis test and compare the results, include different versions with different objects for varying populations. Some people may not know certain objects. Perform this test in the clinic and in a natural setting and compare the results.